Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you today with the weekly podcast of the Common Sense MD. In my practice, I treat a lot of gut problems, as you know. With integrative or functional medicine, if you don't know how to treat the gut and get to the root of the problem with your gut, you're not a really good functional medicine doctor. So you got to consider with all the kind of things we see come in, especially autoimmune diseases, chronic fatigue. There's a lot of reasons for this. We start with the gut. And we take on some pretty tough gut cases. A lot of people with chronic diarrhea or constipation or chronic fatigue. So today I'm going to talk about gut binders. And what I mean about that is that these are medicines, usually mostly herbal, non-prescription medicines. There is one prescription medicine that's a really potent binder that I'll talk about. But anyway, these substances bind to toxins and pathogens, meaning bad bacteria, also fungals, molds, and parasites, even Lyme disease. These binders actually bind to them and sweep them out of your system. It's like detoxing, which is very important. These things cling to the mucosal lining of your GI tract and grab these toxins out of your gut as they pass through. They're essential, especially if you have all these gut problems. I mean, if you're totally healthy, then maybe you don't need to worry about it, but how many people are totally healthy? Problems like IBS, irritable bowel syndrome, especially IBS-D, D means diarrhea. We see a lot of this. Crohn's, ulcerative colitis, it's all a spectrum. So these binders can relieve diarrhea, especially chronic diarrhea, constipation, gas, bloating, SIBO, small intestinal bacterial overgrowth. Now, again, there's prescription binders. The main one I want to talk about is cholestyramine, and there's natural binders. And I'll talk about the differences later in this podcast. So it depends on how severe and acute the problem is as to what I'll use. But remember, we live in a toxic world. Toxins are a problem for us all in today's world. One thing, too, remember, a lot of people are poor methylators. They have that bad MTHFR mutation, which I do. So people with MTHFR problems, they don't detox well. So that's very important to remember with these gut problems. So we live in a toxic world. It's impossible to avoid them. Your liver is actually your main organ for detoxification. So I hope your liver's working good. A lot of us are not. It creates bile, which is a digestive fluid that flows from the liver through the intestines, stored in the gallbladder. It helps break down fats and digest your food for absorption. Now, many toxins are fat soluble, so they enter the bile. So it's in a perfect world, these toxins would all be carried out by the bile. But the gut lining is very delicate. It's made of delicate tissues and veins that can pick up these toxins and recirculate them. This is called enterohepatic circulation. That's very important. Enterohepatic recirculation. So our guts undergo a lot of damage through the years from a lot of different things, inflammatory substances that you can eat through your food. Remember, food's very important in this too. And this is where binders come in. Again, when you talk about food, there's a lot of people with food intolerances like gluten and dairy, corn, nightshades, soy. So food plays a big part in upsetting that gut lining that you get. And this is where binders come in. If your body has too many toxins or your liver is compromised, think fatty liver, alcohol liver, and medicines can cause problems with your liver. So your liver can become overtaxed. So these binders take a lot of the pressure off of your liver. Um, and remember, the longer a toxin stays in your circulation in your body, the more chance it has of triggering a lifelong autoimmune disease. And also, it decreases your overall energy. These toxins compete with your other organs for energy. And a tip I was made aware of fairly recently was that, many gut pathogens in the body, bad bacteria, all these funguses and parasites, they depend on heavy metals to stay alive. I really didn't know that until recently, and I bet you didn't know it either. Because pathogens use heavy metals to create this biofilm, which is like a shelter for the pathogens. It's like a house that they live in. And so this biofilm is created from polysaccharides, proteins, DNA, minerals, and the heavy metals themselves. That's when I hear the word polysaccharides, I immediately think of a FODMAP diet, which is one of my favorite diets for people having gut problems. Robin talks a lot about the FODMAP diet in some of her behind the scenes podcasts. So I like that. And Lucas talks a lot about the FODMAP diet, our nutritionist that works with a lot of our patients. So food's part of the problem. So if you're trying to destroy a pathogen with the biofilm still intact, you're going to have a very unpleasant detox reaction. Think Herxheimer reaction if you've heard that word. So it's going to be unpleasant. So there's a reason to eat the right kind of foods and to use gentle binders at first and then adding more potent ones as you go along. So binders, let's talk about the specific type of binders. The really most potent one that we use is a prescription called cholestyramine. Now, this is a cholesterol-lowering medication that we use as a binder. It works great for IBS-D and something called BAM, which is bile acid malabsorption, which up to half the time may be the same disorder. So BAM and IBS-D, about half the time it's the same thing. So you got to get to the root of the problem. And this is where cholestyramine comes in. It's a great binder because it binds up these bile acids that contain toxins and removes them from the body. It works great for mold as well, which is a serious toxin. It can constipate you. It's a prescription medicine and requires regular monitoring from a physician. So that's the main one that I'll use. And usually I don't use it so much long term unless I'm using it for cholesterol lowering. Usually use it to get rid of the problem and then use the milder ones. But sometimes I'll start out with the milder ones, especially if the problem's not really acute and really severe. So think about the other ones like bentonite and zeolite clay. These are two different minerals. Bentonite actually comes from volcano ash. They work great for soaking up toxins and metals and easing you into detox. They work well together, also great for your skin and have a lot of other benefits as well. So think about the clays. Activated charcoal, a must for your home medical kit that I talked about a couple weeks ago. It's great for acute situations rather than long term. But I think every household should have it in their portfolio for food poisonings. Traveler's diarrhea, it's great for that. It's used in the emergency room for acute poisoning and overdoses, drug overdoses. It's also great for excess gas. So activated charcoal you can get over the counter. Really, really works well. Another one is chlorella. This is one you should probably add to your daily vitamin list, especially if you have any gut problems. This is a blue-green algae that's rich in vitamins, minerals, and amino acids. It's good for metal detox as well. You don't have to have a really potent one for that, seems like with this. And if you do, then it can be a problem. But So you probably want to use this, especially when you remove your mercury amalgams from your teeth if you end up doing that. It's very gentle and very beneficial. Pectin, these are from fruits. Very mild, probably the mildest form of a binder, but they work well in combination with the other binders. Humic and fulvic acids, these are from decomposed plants, and they're very gentle, and one thing about them, you can take them with food. Most of these other ones you should take on an empty stomach, but that one you can take for food, with foods. Silica, great for metals, especially aluminum. Think Alzheimer's disease and the aluminum that may be a precipitating factor for Alzheimer's. It's safe and won't deplete your minerals. Again, when you take something really potent like cholestyramine, you got to watch your minerals. That's why when you take something like cholestyramine, you need to take it away from when you take your medicines or vitamins because it can cause a depletion. It's very potent. Another one that I like is called chitosan. It's a fibrous compound derived from crustaceans, shellfish. Now remember, if you have a shellfish allergy, you can still take chitosan because people that have shellfish allergies aren't allergic to the shell, they're allergic to the meat in those shell foods. This product, chitosan, is in Digest Shield, which is definitely my best overall gut supplements that I've ever found. It's amazing. Aloe vera is another one. It's very gentle and won't cause constipation like some binders can. It also contains many vitamins and is used in combination with other binders and very safe and effective. So I definitely love those. So I'll give you a few tips as well. Take most of these binders on an empty stomach, away from food, supplements, and medications. With cholestyramine, the prescription binder, 1 hour before and wait 2 hours after to eat or definitely take any other supplements. Drink a lot of water, or these things won't work nearly as well. You've got to drink a lot of water. Start slow. Maybe if you have mild symptoms, something like chlorella. That's one of my favorite ones that I've added to my daily regimen, especially since I do have the MTHFR double mutation. Consider taking binders at night. Your body restores and repairs at night. But don't take your nighttime magnesium close to these. You may want to cycle your binders, periodically change the binders that you take. And again, listen to your gut. You need to have normal bowel movements, and you don't need to have a lot of gas or heartburn or indigestion. That's a sign that you've got a gut problem. That gut microbiome is somewhat off, and you need to look into that. Side effects, of course, constipation, like I've talked about, mineral depletion. That's why you want to increase your water intake, maybe electrolyte solution. And magnesium also helps constipation. Just don't take it with your binder. So if you have gut dysfunction, it's complex. So it also is very important for preventing diseases and chronic fatigue. So think about your gut. And I hope this has educated you on these gut binders. There's a lot deeper dive into it. And if you're having a problem, you might want to see an integrated medical specialist to help you sort this out. I hope this helps. This is Dr. Tom Rogers, the Common Sense MD. Thank you.